Imagine it is a normal evening at home. You are over 40, maybe sitting on the sofa after work, scrolling your phone or talking with your partner. Everything feels perfectly ordinary. Then, almost out of nowhere, something looks wrong. A glass slips from their hand. Their smile seems crooked. They try to answer you, but the words come out strange and blurred. Their arm hangs in a way that does not look right. Inside, two voices start arguing. One whispers, "Maybe they are just tired. Maybe it will pass. Let's wait and see." The other one says, "This is not normal. Something serious is happening." That small moment of doubt is exactly where many lives and many brains are won or lost. A stroke is what happens when part of the brain suddenly stops getting enough blood. This can happen because a blood vessel is blocked by a clot, or because a vessel bursts and blood leaks into the brain. In both cases, brain cells lose their supply of oxygen and nutrients. Unlike muscles in your legs, the brain has almost no reserve. When blood flow stops, brain cells begin to die within minutes. Doctors sometimes say, "Time is brain," because every minute without proper treatment can mean more and more brain cells gone forever. The sooner a person with a stroke reaches the right treatment, the better their chance to survive and to recover with less disability. If you are over 40, you might already know that stroke is one of the big health fears of adulthood. Maybe a parent or grandparent had one. Maybe you yourself have high blood pressure, diabetes, or high cholesterol, and your doctor has mentioned stroke risk. The goal of this video and this script is not to make you anxious for no reason, but to give you a clear, practical action plan. There is no home trick that cures a stroke. You cannot dissolve a blood clot in your living room. You cannot repair a broken artery on your sofa. Only doctors in a hospital can treat the stroke itself. But there is something you can do while you wait for an ambulance that helps protect the person from extra harm. Recognize the signs quickly, call for help, and put them in a simple, safe position that keeps their airway open and prevents falls and choking. At the same time, there are a few very common things that people do with good intentions that can actually make the situation worse. Understanding this difference is the whole point. Before talking about position or anything else, one rule stands above all. If you suspect a stroke, you call your local emergency number right away. You do not watch and wait to see if it goes away. You do not say, "Let's see for 10 minutes and then decide." You do not search the cupboard for pills. You do not put the person in your car and drive them yourself. You pick up your phone, you dial emergency services, and you clearly say that you think someone may be having a stroke. That single decision is far more important than any home remedy. Ambulance teams can start care on the way. They can check basic vital signs, and they can alert the hospital in advance so the stroke team is ready. The whole system is built around the idea that stroke patients should come by ambulance, not walk in by themselves. Quick action starts with quick recognition. You are not a neurologist, you do not have a brain scanner at home, so you need a simple way to decide that something is wrong enough to call. Across the world, hospitals and stroke charities use a short memory tool that anyone can apply. Many people know it as FAST. The letters stand for face, arm, speech, time. Imagine the person in front of you. First, you look at their face and ask them to smile. A normal smile lifts both corners of the mouth. In a stroke, one side may droop, the mouth may pull only to one side, or one cheek may hang lower. Then you think about the arm. You ask them to raise both arms in front of them. Usually, both arms should rise to the same height and stay there. During a stroke, one arm might drift down, feel numb or weak, or not move at all. Next comes speech. You ask them to say a simple sentence, for example, their name and address, or "Today is Monday," or "The sky is blue." Normal speech is clear and appropriate. Stroke speech can be slurred, words can be mixed up, or the person cannot speak at all, even if they look awake. The last letter in FAST is time, and it means it is time to act. If you see a drooping face, a weak arm, or strange speech, you do not wait to see if it gets better. You treat it as an emergency and call for help immediately. Some campaigns add 2 more letters at the beginning and call it "Be Fast." The B reminds you to look at balance. If someone suddenly cannot stand, staggers for no reason, or loses coordination, that can also be a stroke sign. The E reminds you to watch the eyes. Sudden double vision, sudden blindness in one eye, or sudden very blurred vision can be a warning. You do not have to remember every tiny detail. What matters is that a sudden change in movement, speech, facial control, balance, or vision, especially on one side of the body, is enough to treat the situation as serious. It is always safer to call and be told later that it was not a stroke than to wait and lose precious time. So imagine you have done this small check. You asked them to smile. You saw one side drooping. You asked about their arm. You saw it fall. You listened to their voice and heard slurred words. You decide not to ignore it. You call emergency services and clearly say, "I think this might be a stroke." The operator asks where you are, asks what you see, maybe repeats some of the FAST questions with you. They tell you that an ambulance is on the way. In that moment, you have already taken the most important step. But those minutes before the ambulance arrives are not empty. In that short waiting time, the way you position the person and the things you avoid doing can help protect their brain from further damage. Your goals while you wait are simple. You want to keep the person as safe and comfortable as possible. You want to help them breathe easily and reduce the risk that they choke if they vomit or if saliva builds up in their mouth. You want to prevent them from falling. You also want to keep the situation as calm as you can, so that their blood pressure and stress do not explode even more. You cannot see what is happening inside the brain, but you can control what is happening around the person. If the person is awake, can breathe on their own, and can respond at least a little, you can speak to them calmly. You might say something like, "I have called an ambulance because I think you may be having a stroke. I am going to help you lie down in a safe position while we wait." Then you help them move from a chair or standing position to a lying or semi-lying position. Many first aid guides for stroke and unconscious patients recommend the side-lying recovery position as a safe standard. For a conscious stroke patient, you can use a gentle version of this. The person lies on their side, not on their stomach, and not flat on their back, with the head slightly raised on a pillow, folded blanket, or rolled-up jacket. The face is turned a little towards the floor, so the mouth is not pointing straight up. One leg, usually the top one, is bent at hip and knee to stop them rolling fully onto their stomach. If this sounds too complicated, picture it more simply. You do not want them slumped on a chair where they can fall. You do not want them flat on their back where vomit can go into the airway. You want them resting on one side, low and supported, with the head a bit higher so they can breathe easily. That is all. If they feel more comfortable half-sitting with their back and head propped up by cushions and the upper body at an angle, and if they can stay stable that way, that can also work. The key is that they are not standing, not walking, and not left in a position where a sudden drop in consciousness could cause a dangerous fall. If the person is not fully awake, answers only vaguely, or does not respond, but you see that they are still breathing, you do not keep them sitting. You gently roll them onto their side into a full recovery position. You place one arm so it is out in front. You bend the upper leg to support the body. You tilt the head slightly back so the airway is open and the mouth is angled downwards. You may have seen this position in basic first aid classes. It is the same principle here. If they vomit, the vomit will tend to flow out of the mouth onto the floor or the blanket, not backward into the lungs. The tongue will be less likely to fall back and block the throat. If they become more unconscious, they are already in a position that protects breathing as much as possible without equipment. If at any point you are not sure how to move them, you can tell the emergency operator on the phone. In many countries, operators are trained to guide callers step by step through the recovery position. If you see that the person stops breathing or their chest no longer moves, this becomes a different emergency. Then the operator will likely instruct you to move them onto their back and start chest compressions. For this script, we stay with the situation where they are still breathing, even if weakly, and the main question is how to keep them safe while you wait. While all this is happening, your emotions will be strong. Many people deal with that feeling by trying to do something more, and unfortunately, some of those things are harmful. One of the most common reflexes is to offer water or another drink. It feels comforting. In normal illness, a sip of water is usually harmless. In stroke, the muscles that control swallowing can be weak or uncoordinated. Liquid can go down the wrong way, straight towards the lungs. The person might cough, choke, or aspirate fluid into their airways, which can later cause serious pneumonia. That is why in suspected stroke, you do not give anything to eat or drink, even if the person asks and even if they say they feel thirsty. Protecting their airway is more important than a few minutes of thirst. Another very common reaction is to reach for aspirin. The idea sounds logical on the surface. If a stroke is caused by a clot, aspirin, which affects clotting, might help. The problem is that some strokes are not caused by clots, but by bleeding. If there is bleeding in the brain, anything that thins the blood can increase that bleeding and make the situation much worse. At home, you simply cannot know which type of stroke is happening. Only a brain scan in the hospital can show it clearly. Because of that, it is safer not to give aspirin or any other medicine during a suspected stroke unless a doctor or paramedic you are talking to specifically tells you to do so. There is also a temptation to give other pills, such as extra doses of their usual blood pressure medication or calming tablets. This is not a good idea. You do not know how their blood pressure is behaving at that moment. Lowering it suddenly could be harmful, and mixing extra tablets with any emergency drugs given later could cause problems. The safest approach is to leave medicine decisions entirely to professionals and focus on what you truly can do. Call, position, protect, and wait. Another big mistake is to try to transport the person to the hospital in your own car. Many families do this thinking they can arrive faster, or because they worry that an ambulance will take too long. But when you choose private transport, you lose all that an ambulance offers. There is no equipment in your car to monitor their condition, to give oxygen, to start early treatment, or to communicate with the hospital. If the person vomits or loses consciousness in the car, it will be very hard to help while driving. You might also drive to a hospital that does not have a stroke unit or a CT scanner available right away. Then you lose more time being redirected. When you call an ambulance, the system can route you to the right place more directly. Even if the car feels faster in your mind, the overall chain of care is usually slower and riskier. While you keep them in the safe side or semi-sitting position, there are a few quiet, useful things you can do. One is to note the time when the symptoms started or when you last saw them normal. This can be as simple as glancing at your phone and remembering that you noticed the strange smile at 1940. If you found them already affected and do not know exactly when it began, think of the last time someone saw them well. Maybe they were fine when you spoke at lunchtime. Tell the paramedics what you know. Doctors use this timing to decide which treatments are still possible. You can also quickly gather their medication boxes, any medical ID card, and if you know it, the names of their chronic conditions. Put everything in one place so that when the ambulance arrives, you can show it immediately. This saves time and helps doctors avoid dangerous drug combinations. You can loosen tight clothing that restricts breathing, such as a tie or a very tight collar, but without moving the person more than necessary. If the room is cold, place a light blanket over them. If it is very hot, you can open a window or fan them gently, keeping their face uncovered. And you can gently ask bystanders not to crowd too close so there is space and air. Now imagine a different version of the story where the person having the stroke is you. You are in the kitchen, you pick up a cup, and suddenly your hand does not feel right. You try to tell your partner something and the words are wrong. You look in the mirror and one side of your mouth looks strange. If you are like many people, your first reaction is to deny it. You tell yourself you are just tired, you need sleep, you do not want to bother a doctor or call an ambulance for nothing. This is absolutely understandable, but it is also how many people lose their chance for early treatment. If you still can move your hand and reach your phone, the most important thing you can do for yourself is to call emergency services at once and say, "I think I may be having a stroke." Do not wait to see if it gets better. Do not lie down to sleep it off. Do not get into your car thinking you can quickly drive to the hospital. If someone else is in the home, call for them loudly. If the door is locked and you are still able to walk a few steps safely, consider unlocking it for the paramedics. Then, once the call is done, you again think about position. You sit down or lie down, so that if your balance gets worse, you will not fall. Ideally, you roll onto your side with your head supported by a pillow or folded blanket. You try to keep your mouth angled slightly downwards, so that if you vomit, you do not choke. Then you wait and focus on breathing slowly until help arrives. Sometimes stroke symptoms seem to appear and then disappear after a few minutes. This is sometimes called a mini-stroke or transient ischemic attack. It can be tempting to ignore it because you feel fine afterwards. That is dangerous. A mini-stroke can be a warning sign that a bigger stroke is coming soon. Even if the symptoms go away completely, you still need urgent medical evaluation. The same rules apply. You call emergency or seek immediate medical help and do not simply return to your normal day. People sometimes ask whether they must place the head at a very specific angle, or whether lying flat might be better for blood flow. In hospital research, doctors have experimented with different head positions, but the differences in outcome are small for most patients. At home, you do not need to think about degrees and angles. The simple principle is this: the airway should be as open as possible, the person should be safe from falling, and it should be easy for fluids to leave the mouth and not go into the lungs. A slight elevation of the head and shoulders while lying on the side or in a supported semi-sitting position achieves that well enough. It is important to say again that none of these positions and simple actions cure a stroke. They do not remove the clot. They do not stop a bleed. They do not repair damaged cells. Only fast, proper medical care can do that. What these steps do is protect the person from avoidable extra damage caused by falls, blocked airways, or delayed emergency calls. They are not treatment. They are first aid. They create the best possible conditions for the real treatment that is still on the way. If you are over 40, you do not need to live in fear of stroke every day, but you can carry a small plan in your mind. Recognize sudden changes in face, arm, speech, balance, or vision. Do not argue with yourself for too long. Call emergency services immediately and say the word stroke. Then help the person into a safe, side-lying, or supported semi-sitting position with the head slightly raised and the mouth angled so fluid can drain. Do not give them food or drink. Do not give them aspirin or other pills. Do not let them walk around, and do not put them in your car. Stay with them, speak calmly, and wait for the ambulance. This plan is simple enough to remember and powerful enough to make a difference. In those few long minutes before help arrives, the position you choose and the actions you avoid can truly help protect a brain that is under attack.